Hey, Spoonie fam. So I popped into the online kind of like my chartish thing for the pain clinic that I went to last week. And like I said in the previous video, I've learned that you always go in and check your after visit notes that the doctor puts in to make sure that they are factual and that there's nothing in there that's going to cause you issues down the road for health treatments or insurance issues. Um, so I went and checked the after visit notes, and this is what it says. I'm gonna grab my computer so I can read it to you because yes. So the patient is aware that chronic pain management requires them to have an active role in their care, which involves the psychological aspect of pain coping and management, continuation, initiation of exercise and activity, as well as nutritional support for the body. I'm in physical therapy. I can't fucking walk more than a few feet, and and I can't eat because everything makes me freaking sick. So thank you. This The psychological aspect of pain management involves good pain coping skills, the use of mindfulness, meditation, and relaxation techniques, developing the habit of positive thinking and attitude, as well as working to stop catastrophizing the pain. That fucking just pisses me off. In regards to the physical aspect of pain management, patients should initiate resistance training, aerobic and stretching exercises. The nutritional aspect of pain management should consist of eating whole, unprocessed foods with high protein, low carbohydrate, and avoiding sugary foods, fast foods, inflammatory foods, as well as ceasing any harmful habits such as smoking or drinking. First of all, that it says that I was notified of that. That was not ever said to me. None of that was said to me because I would have addressed that with him real fucking quick. I'm in physical therapy, okay? Right now it's in the water because that's the only place that I don't have pain. I actually did get a membership to the Y so that I could go on the days that I don't have physical therapy when I'm not in high pain to move my body because that's what I want to do. But it's freaking annoying to me. And then the nutritional aspect of it. I was low carb keto before all this happened, okay? I tried very hard to stay there because I know personally that because I am neurodivergent, this is my belief, that a low carb keto diet helps with my brain function. My brain is much clearer when I'm eating keto. However, right now, there are times when I have to just eat whatever I can hold in my stomach that's not going to make me run to the bathroom and puke. So if that's Ritz crackers and cheese, that's what I'm going to eat. When my husband's at work, I can't stand to cook a meal a lot of the time because it hurts too much. Like this morning, I'm not even eating because I'm nauseous and I'm in pain. With this, none of this was ever said to me. None of it. Like, I didn't even have an opportunity. It's like, and this positive thinking and stop catastrophizing their pain. I'm so furious right now. I don't even know. I am in so much pain that a few months back, I went to the emergency room because I didn't want to be here anymore. Because I was living in an endless loop of no sleep because of pain and then trying to get through the day hoping that I'm going to be able to sleep and then not sleeping and can't even like laying in bed because luckily those pain levels have gone down. Come to find out that was a side effect to a medication and that they had given me for the pain. And I was having a conversation with my husband the other day and he was telling me he doesn't know how I do it. that if he were in my shoes, that he would not be here anymore, that he would unalive himself. And I told him, I have had to accept that this is my life. I have had to let go of that hoping to go back to the way things used to be, because I knew that that was holding me in a situation that I was never going to find joy, because it wasn't what I used to have, and I'm never going to go back to what I used to have. So having to find joy in what I do have. And that is him, my kids, and my grandkids. Those are the things that keep me going every fucking day. And what I do, and I discussed this with my physical therapist, I think that one of the reasons why during the day, my brain is obviously awake and functioning, so I compartmentalize the pain. When something starts hurting, and like I said in a previous video, or it feels like, say, somebody's trying to break a joint or break a bone, I feel it and I'm like, oh, wow. And then immediately, my brain takes that and compartmentalizes it, because I know that it's going to be there. And I can't focus on it because it will make it worse. Now at night I can't do that. I'm asleep. And I honestly believe that that's one of the reasons why I don't sleep, because I can't compartmentalize the pain. It's constantly waking me up, but I honestly feel like that statement is a way of putting it back on chronic pain patients, that it's our fault, that we're just not trying hard enough to cope with our pain or not catastrophize our pain. The rest of it he wrote in there was talking to me about the hazards of opioid medication, which we didn't even discuss me being on opioid medication. I talked to him about tramadol and he shut that down. But he says that he went over the risks and this and that, a big long paragraph about all that opioid med that he didn't say jack shit one to me about. So, I don't know, y'all. I'm so damn tired. I really want to cry right now. I'm tired of it. I'm tired of it all.